Day. My name is Sue Weldon. I'm the founder and CEO of Unite for Her. And, this day is such an important day. It's a global day of giving where everyone links arms to support nonprofits doing incredible work across the nation, across the world, in areas that are really meaningful and making change and making lifelong change. And for us at Unite for Her, we find it very important that you hear from the community that we serve and also our physician partners. So today I am with Dr. Dela Cruz. She is a breast surgeon in the Washington, D.C. area with Medstar. And Dr. Dela Cruz, would you like to introduce yourself and share a little bit of your perspective on the Unite for Her program?
Thanks, Sue. Hi, everybody. My name is Lucy Maria de la Cruz. I'm a breast surgeon. I'm the chief of breast surgery at Medstar Georgetown University Hospital, and I'm also the director of the Betty Lou Orisman Breast Health Center. I actually met Sue several years ago. Even before I came to Georgetown, actually, I knew about Unite for Her when I was at University of Pennsylvania. And actually, Sue and I have talked about this, that, when I first started treating breast cancer, we focused on the surgical component. Obviously, I'm a surgical oncologist or a breast surgical oncologist, and we focus on the chemotherapy regimens. We focus on the radiation, and then we forget a little bit about the patient as a whole. And it's not to say that the three components that I mentioned before are equally important. They're extremely important, but we also have to understand that patients, when they come into our door, they have other issues that we may not address. And that's something that I sincerely loved about your foundation, that it provided that, kind of that element that we missed maybe when we just focused on one thing. And it was kind of a gift that you give to patients. And I've been lucky enough to be able to bring it on to Georgetown and our MedStar health system. But really, it's something that kind of becomes a synergic relationship between the medical component plus the integrative medicine component or integrative aspect of breast cancer treatment.
Yeah, and for us, we know it's so important. Like your role is so key because we want them to see the collaborative approach of this whole patient care, the medical community, the wellness community, the pharma community, all linking arms so that the patients adhere to treatment. Because Dr. Dela Cruz, that isn't always the case. Like there are difficult, obstacles in the way that sometimes the patients abandon treatment and it's not quite, as easy as it might seem to set up this regimen and have them follow through. Can you talk a little bit about that and what you see?
Oh yeah, I mean, 100%. I think that when we talk about breast cancer, we forget about the fact that it's intrusive in your everyday life, not just from getting the therapies and having surgery, but really doctor's visits, interrupting your workday. If you're a single parent, you are potentially impacting your income, potentially impacting the ability to provide for your family. Also, I always say that I remove breast cancer from the breast, but I can't remove it from the thoughts and mindfulness and how that impacts the patient who is going through this journey without potentially even having anybody to rely on, not only financially, but emotionally and physically to help them with their struggle or with their journey. Financial burden, right? We don't really realize the impact of deductibles, added cost to, just even transportation to go see their doctors if they don't have a car, limitations for childcare. If they are the caretakers of a parent, who's going to take care of that parent when they're having surgery? I mean, these are so many things, and the complexity of breast cancer treatment. I tell the people in my office, I say, always remember that even though you had a bad day, most of our patients are here in a very vulnerable place, and to be thoughtful of that. And so I try to leave that bad day at the door. And when I come here, I try to give my patients the best of me, because I know that this may be, a moment that is fearful, that is vulnerable, that is anxiety ridden. And I'm here just to be able to provide them with some support for those 30 minutes that I'm with them. For that was 45 minutes. And so I always remind myself of that purpose. But I think that your foundation does a great job, even when they leave these doors, when they are home, to be able to feel cared for, to even just get something on the mail that says, hey, so and so, hey, Miss So and so, this is for you. It makes them feel that they're not alone. And I think that that's something that, a lot of people don't realize, that patients who go through cancer are feeling. There's fear, there's anxiety, there's financial issues, there's emotional issues, there's grief. there are so many emotions involved with it. And I think that that cannot be taken care of with just surgery, radiation, and chemo. That takes a part of the integrative aspect of how we treat breast cancer. And that's what I think, I mean, I sincerely believe in it. And I think that patients who have that support, but also value the integrative component, aside from the medical component, that brings great balance, and that potentially impacts how they view their journey.
Yeah, I love that you say you show up, just 100% just ready to meet them where they are. And the fact that we can be your partner and share these $2,000 worth of integrative therapies that you can offer them, and share that this will help you with your mental health. You can do counseling, sexual health. You can end up doing nutrition consults or go to cooking webinars, look at different Reiki, yoga, meditation that we pay and deliver. That helps, the whole team move forward in a way that's going to give them empowerment, control, self-advocacy, right? And that helps you do your job better. So we're just so grateful to be your partner, Dr. Dela Cruz. You've helped us tremendously in Washington, D.C. You were our first, go-to when we started the program there, and it's growing, and we're getting to our underserved communities as well, our Latina populations, our women of color. We know the health disparities, and you really have helped us expand in a way that, we can't do it without you. We are truly stronger together. So thank you for hopping on today. I feel like it's so important that we hear from those that we partner with, because all of you out there are supporting Unite for Her in ways that are moving the needle further than you imagine. So
Well,
yeah,
Sue,
anything else?
Sue, it's my pleasure. And I think that it goes to say your devotion and your dedication to the cause. I must say that, yoga, meditation, mindfulness, those are three things that have strongly been proven to improve outcomes in patients who undergo breast cancer, and even any cancer, and also decrease side effects from adjuvant therapy. So I am I am your biggest fan. I am your number one fan for life.
Thank
And
you.
so thank you for all the work that you do for all these women who may never have had the opportunity to have access to this. So thank you.
Yeah, you are welcome. And I'm so glad that you talked about, the data and the science behind all these therapies. If you all, as our Unite for Her community, want to see more, go to our poster and abstract that we were at the San Antonio Breast Cancer Symposium. We were selected for that poster abstract, and you'll see all the data there. It's at uniteforher.org/SABCS. And you'll see those outcomes, and you'll see how patients actually did better and adhered to treatment better and took less medications. And for us to be able to document that in such a meaningful way at one of the largest breast symposiums in the nation, that speaks volumes on your support and what you've been able to allow us to do. So on this Giving Tuesday, thank you all for joining us. If you are so moved to give, we hope that you give to Unite for Her. We are set to serve over 5,000 individuals this year alone, and we don't want to turn anyone away. And as we move across the nation, we're getting more and more known. We're seeing those outcomes do better, and it's because of your help. So thank you so much.
Well, thank you, Sue. Keep up the great work. And again, thank you for the opportunity.
You got it. All right, everybody. Have a good day.
Bye, everybody.